Hi everyone, my name is Maya Sanchez, and this is Case Study 21, Simulated Epidemic. So, in April of 2017, the Minnesota Health Department was notified of a 25-month-old child with measles. He had no travel history and no record of having received the MMR, measles, mumps, and rubella vaccine. The next day, there were reports of two more cases occurring in siblings, 19 and 34 months. All three patients attended the same childcare center, and after genetic testing, the strains were found to be the same. After the first report, the health department, along with other departments, started an investigation with emphasis on children over 1 year of age receiving their first dose of the MMR vaccine. They interviewed patients with measles or their guardians. They found thousands of exposures in childcare centers, schools, and healthcare facilities. By the end of May that same year, 65 cases had been confirmed, and 8,250 people were potentially exposed. Of the 65, 20 were hospitalized with thankfully no deaths, and over 75% of confirmed cases were in those eligible for the vaccine, and 95% were unvaccinated persons. The stat that's most relevant for this case study is that of the confirmed cases, 55 were US-born children of Somali descent. For multiple decades, Somali immigrants settled in Hennepin County, Minnesota. And in the early 2000s, parents have started to share the belief that autism affected Somali children at a higher rate compared to other ethnicities, and that the MMR vaccine was responsible. Despite no evidence existing that links the MMR vaccine to autism, the misinformation resulted in many Somali parents not vaccinating their kids. And by 2015, only 46% of Somali children had one dose of the MMR vaccine by 24 months. However, despite the misinformation about the vaccine, Somalis did hold health professionals in a high regard, and the Minnesota Department of Health found that by establishing a bond between patient and healthcare professionals, the misinformation could be lessened. So the health department and other agencies worked with Somali health advisors, medical professionals, faith leaders, elected officials, and community leaders to educate the public about the outbreak, the vaccine, and autism. The result was an increase in vaccination rates, with the number of weekly vaccine doses going from 2,700 before the outbreak to 9,964 by the end of the second week of May. Some overall takeaways from this case study highlights the importance of quick response from our health agencies and the formation of a bond between health officials and the community, which is very important for those students who plan to be going into medical fields to keep in mind, because once you enter the workplace, you'll be making those decisions and cultivating that bond between you and your patients. And it's important to realize just how much of an effect it can have to take a bit of an interest into your patient's culture and community. This was Case Study 21, and I hope you enjoyed it.